The stapes is notorious for being the smallest bone in the body, but what that does is these bones sort of amplify the movements of the eardrum, and then the stapes pushes fluids in this inner portion of the inner ear, and that transmits sound. Here we go. Yes, so what this stapes pushes basically fluid, and the fluid moves in waves. What the inner ear does is take those waves and makes it into basically electrical information for the brain to interpret. So it's very, all this mechanics are probably within the space of a nickel or quarter and encased in bone. It's really. So here's a video animating basically what I described. The sounds coming into the eardrum. Ear canal. And that's what a normal eardrum would look like. There's the eardrum vibrating. So here is sort of a 3D picture of your malleus, which means hammer. The incus sort of connects the malleus and stapes, and the stapes looks like a foot plate, basically a stirrup with a foot plate, and the important movement is right here at the stapes foot plate. There. And you can see how sound, or the movement, would be amplified by this mechanism. I think it amplifies it by 22 times so that you really can hear very low sound levels very clearly. Here we are inside the inner ear. These are what's called outer hair cells. So this is one cell on a microscopic level with tiny hairs that stick up. And basically what they're measuring is movement of a membrane from the sound wave. And it uses electrical potentials to send a message to the brain. And this is a cross-section of the cochlea, basically the inner ear. And like I said, this is the inner ear fluids that move when the stapes foot plate moves. And there's the electrical currents I mentioned. Amazing, isn't it? Great. Okay, so that's when everything works perfectly, but we all know it doesn't always work that way. We do have hearing loss, not uncommonly, and the 2 points I'd like to make are go over common causes of hearing loss, and I'm not going to get into too crazy amounts of rare causes, but just common causes of nerve-type hearing loss and conductive hearing loss. We'll go over the difference. And then, how come most hearing losses aren't medically or surgically correctable? Why do so many people walk around with hearing aids and not have a simple surgery or procedure or medication to fix it? I will not address the question of, is he listening or can he not hear? That's for later. Okay. So the initial part of any hearing evaluation includes an audiogram, and it's a very standardized, oops. My fault. You don't hear doctors say my fault very much. So. Anyway, an audiogram basically goes from low pitch to high pitch, 125 hertz to 8,000 hertz, and normal hearing is considered between 0 and 20 decibels, all the way down to a profound hearing loss here. And so, hearing loss can range anywhere from normal hearing to a mild hearing loss, what we call a moderate hearing loss, and severe and profound. This is really a logarithmic scale. So if you hear percentages, I really try to get away from using a percentage of hearing loss. The difference between 10 decibels and 20 decibels is tenfold. It's not 10%. So, but I'll show you some examples of different hearing losses. And one distinction we really want to make is the difference between a conductive hearing loss and a sensory neural hearing loss. And make the point that conductive hearing losses are relatively rare, but you don't want to miss it for good reason. The audiogram looks such like you have these brackets, which are bone conduction, where we bypass the eardrum and stapes and all that and goes directly to the inner ear. But the patient's actual hearing is down here in a moderate range. And so you see this gap that forms between the two. In contrast, a sensory neural loss, or more common hearing loss, really has the bracket and X's superimposed to where there's no gap. And this is a much more common situation. So again, an audiogram is a very important part of the initial evaluation of hearing loss. It's important it's done by somebody who is experienced, and for this reason, it's oftentimes a good idea to see an ENT or ear, nose, and throat doctor before committing to hearing aids as well. So let's go over conductive hearing loss. This kind of gets the surgeons excited because it's fixable. And honestly, the easiest to fix type of hearing loss is earwax in the ear canal. You can imagine, just like an earplug in the ear canal, earwax can do the same thing and really muffle hearing, and that can be removed in a matter of seconds or minutes in the office. Also, a hole in the eardrum from trauma or infection, previous surgeries, what have you. That can cause a hearing loss because it doesn't move the eardrum as it should. You can also get fluid in the middle ear space. I'm sure you've heard of children who get tubes. Well, that's the main reason, and that fluid can really impede sound transmission from the ear canal into the inner ear. And that's usually caused by the eustachian tube not working well, that sensation you get when you land in a plane and can't pop your ears. More complicated causes of conductive hearing loss includes otosclerosis, or bone formation around the stapes, or disarticulation of these ear bones. Now, not as common, but also potentially correctable. So just to review, that conductive hearing loss really is a minority of hearing loss, but important to find because potentially fixable from easy to hard. You know, wax removal is very simple. We can put a tube in, we can fix the eardrum, we can remove that excessive bone around the stapes or reconnect the ear bones, but unfortunately not the most common cause of hearing loss. So in contrast, sensory neural type hearing loss is the most common cause, and the best way to envision it would be to divide the ear into three parts: the ear canal or outer ear, the middle ear where the bones are, the inner ear where basically mechanical transmission is turned into electrical information. And that's the location where sensory neural hearing loss occurs. And the important point is that unfortunately this day and age is not fixable. And it shows here this, just like the animation we watched, it's when these outer hair cells sort of die off for reasons unknown. There's no way to really turn these back on or replace them or get them to function again. So, a couple of common causes of sensory neural hearing loss. One that's still seen relatively frequently today is a noise-induced hearing loss, and it has to be repeated exposure, almost daily exposure over a long period of time can cause this hearing loss that's worse at 4,000 hertz and recovers at 8,000 in the early period, and can turn into just a sloping hearing loss, but really does not affect the low frequencies as much. And then presbycusis is an age-related, and let me tell you, it's not from getting younger. But it produces this relatively characteristic, worse in the higher frequency, mild to moderate, relatively flat type hearing loss. Although, and they'll go in later into this, but the discrimination ability of the cochlea remains relatively intact in general. And it's important to have an audiogram for any hearing loss, I think, in case that you might pick up somebody with one-sided sensory neural hearing loss. The hearing test here suggests that one ear is normal, but the other ear has a severe hearing loss. And so less common causes of this would include viral inflammation, labyrinthitis, Meniere's disease if there's any vertigo or fullness or ringing sensations. And even less common, but we always are on the lookout for a benign tumor of the inner ear or inner ear nerve, called a vestibular schwannoma. Those types of things will cause hearing loss only on one side, and as a physician, when you see a hearing test like this, alarm bells go off, and we might do more of a workup. Patients with this type of hearing loss can do very well in a very quiet room with a loud voice, and may have difficulty localizing sounds and really understanding speech in noisy situations. So in summary, let's get on to the interesting stuff here. Common causes of hearing loss would be conductive hearing loss, or fixable things like I mentioned. Sensory neural hearing loss is more of a permanent, non-fixable cause of hearing loss and more common. Age-related hearing loss and noise-induced hearing loss are very common. And we just can't regenerate these outer hair cells. Obviously, there's plenty of research ongoing now, but it's not medically or surgically fixable as of today. And this is where hearing aids can be very helpful. So, thank you. I will pass it on.